Hi, I'm Peter Singer. I've been a professor of bioethics both at Monash University and at Princeton University in the United States. I want to support the proposed amendments to Victoria's voluntary assisted dying legislation, which was first passed in 2017. I think the legislation is generally working well, and I have had some personal experience of it. A member of my own family used it and had a much more satisfactory ending, I would say, for the family as well as for the person themselves than they would have had without the legislation. But I've also had friends for whom it hasn't really been available in the way that it should be. And I think amendments can help. One of those amendments would be to widen the period that the Act can be used from the current 6 months before death is considered likely to 12 months. That would give people more time to get used to the idea and would, I think, remove some of the uncertainty about whether a person is or is not in compliance with the legislation when their death is uncertain, as it often is. I mean, it's certain that it will occur within a relatively short period, but whether it's 6 months or 7 or 8 months, may not be sure. And that was certainly the case with one of the friends that I had who was considered unable to use the legislation, and I think his death was not as good as it might have been. There are other amendments as well that I think clearly make sense, including allowing medical practitioners to initiate a conversation about voluntary assisted dying with patients who may not have any idea that such legislation even exists, and to expect them to make the request when they may not know that the legislation exists really means that they are denied an opportunity that they might have wished to take advantage if they had known that it exists. So I hope that these and other amendments will be taken up by the Victorian government, as it has said it will, and that they will be implemented soon, because in this matter, delay is going to mean that some people have a less desirable death, if you like, a less comfortable death, a death that is not of their own choosing in the manner in which it occurs. And of course, it may therefore mean that they suffer more towards the end. So I think we need to pass these amendments. We need to have the community discussion about them, of course, but let's get that discussion started and let's make a decision sooner rather than later. Thank you.